when you're diagnosed with cancer, you just feel like a pinball in a machine, right? All of a sudden, you're just going from one person to the next, and all it feels like all these things are being done to you, and then they're like, you have to take this really horrible medicine, and it's really effective, but it's not. It doesn't really feel like something that you're in control of, and so. I just think the most important thing is improving the quality of life, like reducing the symptom burden, of course, through these lifestyle behaviors, but also sort of handing you your life back. Which is what it's done for me.
And you're focused on breast cancer. You are a breast cancer survivor now. You're in remission or whatever is that the correct medical
terminology? Breast cancer is a little bit different than other cancers in the sense that that you go through what they call active treatment, which is surgery, chemo, radiation, those kinds of things. Depends on the type of cancer that you have, what of those. And then you kind of graduate from that and they call you a survivor. And for 80% of breast cancer patients, they put you on an endocrine therapy, which blocks all your hormones. And it is horrible. So the worst side effects for me by far came from this endocrine therapy. It's like menopause times 1 billion. And so immediately I became diabetic and had pretty almost crippling arthritis. And the side effects are very profound. I couldn't sleep. I didn't have, it was really something. And the only thing that the traditional medicine, this is now a part of traditional medicine. You can be board certified as an MD in this, but, my doctors really, the only thing that they would do is offer me, more drugs, right? So a sleep aid, but then I would say okay, well, I took the gabapentin, but I know that you guys call that the stupid pill, and I really feel it. And I was already having problems with, when you have no estrogen, your brain actually shrinks measurably and your memory starts to falter. And I was already having problems with focus and brain stuff, right? And so, as I can't come up with the word. Anyway, so they're like, okay, well, you should definitely be on Adderall, right? So take gabapentin at night and Adderall in the morning, and metformin 3 times a day to help control your blood sugar. And it was just like one thing, and none of it all worked very well. And I ended up with an internal bleed that led to anemia. It was like these medications that was caused by a medication for the osteoporosis I developed instantly, over the course of just a year. I went from having normal. Anyway, it has terrible side effects. Let's just put it that way. But all those side effects can be managed through things that I have control over. I have control over how much time I'm in bed, if not my actual sleep quality. I have control over how consistent I am about when I get out of bed, when I wake up. And I have control over how much I move during the day and the timing of that exercise. And just all the things that there's just so much research that shows that I may not have what I need from an estrogen standpoint to regulate my blood sugar, but I can get my body to regulate it in a totally different way by just doing a few squats after I eat, or moving or standing up and moving around a little bit.
Yeah. So you were not seeing yourself as a passive body that was receiving traditional medicines, though they were helpful and necessary in some cases. But you became an active researcher and agent in altering your own behavior.
And the belief is that if you have cognitive decline or diabetes or some sort of cardiovascular disease, like
Or
these life
osteoporosis.
or osteoporosis or whatever, these sorts of lifestyle changes, there's so much research that they work really well alongside the traditional pharmaceuticals. And sometimes they work alone if there's no pharmaceutical that works. And
Right.
certainly it like helps with everything. Like breast cancer recurrence drops by about 15%, not recurrence, death from breast cancer drops by about 15% for each increment of exercise per week that you do. Like it's completely quantifiable in terms of like how life-saving this stuff is. And it really applies to everyone. I mean, when you're diagnosed with cancer, you just feel like a pinball in a machine, right? Like you have all of a sudden they're like, okay, well, you have to make an appointment with, you have 5 oncologists, you have 5 doctors, like you have a surgeon and a medical oncologist and a radiation oncologist. And like you just name it. There's just like all of a sudden you're just going from one person to the next. And all it feels like all these things are being done to you. And then they're like, you have to take this really horrible medicine. And it's really effective. It's going to reduce your risk of recurrence by 50%, right? It's very effective. But it doesn't really feel like something that you're in control of. And so I just think the most important thing is improving the quality of life, like reducing the symptom burden, of course, through these lifestyle behaviors, but also sort of handing you your life back. Which is what it's done for me.
It's wonderful. The work you're doing is always so great. Christine Carter, author of Raising Happiness. So thanks for joining us in the sweet spot here of Diacardia. Totally grateful to you.
Thank you for having me.
Of course. I have hiked with Christine and just sat with her sometimes on this brutal journey where she's faced down sickness, loss, cancer, and death. It's been incredible to watch her fight back. As you could see, her energy is infectious, or to say that word a little differently, it infects us with positive energy. How did she make you feel? Leave a comment to let me know. In our 3rd episode, upcoming with Dr. Carter, she takes us on a journey with her dad. You don't want to miss it. Diacardia, great guests who speak so openly from their hearts to yours to help us all to grow and sustain great relationships. I'm Dan Mulhern.